President Trump's recovery from COVID-19 is taking place at the White House. He was released from Walter Reed Medical Center yesterday and said on Twitter today that he's feeling great.
As doctors say, the president is reporting no symptoms and overall is doing extremely well. President Trump's treatment plan included an experimental antibody cocktail, and there are calls for the White House to list all of the medications the president has taken.
The treatment President Trump received while in the hospital is not what a typical person would get. That's according to a Portland State University public health professor.
Now that President Trump is back at the White House, Fox 12's Sarah Hurwitz is taking a look at those differences in treatment.
Well, President Donald Trump received a treatment for COVID-19 that was 3 separate drugs that many patients would not receive so early, some of them being experimental that many Americans would not have access to. The professor that I spoke with today said that he is not surprised with that treatment because he's the president of the United States. President Donald Trump is now back at the White House being treated for COVID-19 there after he was discharged from the hospital Monday. Trump tweeted, "I feel better than I did 20 years ago."
The quality of the treatment, I would argue that is superior than the quality of the treatment that any average citizen will receive in most hospitals.
Carlos Crespo, a professor for OHSU and PSU School of Public Health, says that the president has access to treatment that others don't.
For most of us, we are nickel and dime every time we approach the healthcare system. It's either co-pays, it's either deductibles. That is one thing that the president said does not have to worry. It doesn't have to worry about how much it will cost.
Trump received an experimental antibody therapy, remdesivir, and dexamethasone, which, according to a professor of medicine at George Washington University, the president might be the only patient on the planet ever to receive this particular combination of medicines. Remdesivir is the first drug shown to help fight COVID-19. It has not been approved by the FDA, but it got an emergency use authorization from the agency. And dexamethasone is a steroid.
I could say that maybe one of the medications are not something that are readily available for any doctors to say, okay, let's prescribe this and it's going to be available tonight or right away.
In an interview with CNN, OHSU Dr. Esther Chu talked about the expansive treatment for President Trump and conflicting information on his condition.
We've heard that he's both energetic and fatigued and lethargic. He both has a fever and doesn't have a fever. He possibly was on oxygen but doesn't have an oxygen requirement. He is perfectly well and we expect him to go home in 2 to 3 days, but we're also doing serial ultrasounds on him. Ultrasounds of what? We don't know. If it's an ultrasound of the heart, which is what I suspect, what a curious thing to do on somebody who you think doesn't have serious symptoms of coronavirus.
And according to Professor Crespo, President Trump has also had access to frequent testing, while many Americans have had difficulty getting one administered and also dealt with delaying results. In Southeast Portland, Sarah Hurwitz, Fox 12 Oregon.